At some point in your late 30s or early 40s, that text message on your phone starts blurring. You hold it a little further away, and suddenly it snaps into focus. When you are young, the clear lens sitting inside your eye is highly flexible, effortlessly bending to shift your focus from a distant highway to a book in your lap. But as you age, that lens continuously lays down new cellular layers. Year by year, it gets physically thicker and stiffer. That structural stiffening is called presbyopia. It is not a disease, and it isn't poor health. It is simply a universal mechanical change that happens inside the eye. This animated graph tracks the biological flexibility of your lens over time. The decline is gradual, but at age 40, flexibility plummets. The good news? It's not infinite. By your mid-50s, the lens loses all natural flexibility, and progression flatlines. The earliest warning sign usually hits at the end of a long workday. Your eye muscles become completely exhausted from trying to force that rigid, stubborn lens to bend. You cannot halt this biological clock. Your lens will stiffen, and eventually you have to rely on an external optical intervention. The choice in front of you is no longer whether you will need vision correction. The choice is deciding how to balance financial cost, adaptation time, and daily convenience. The most accessible path forward is a trip to the local pharmacy for over-the-counter magnifying readers. These are cheap, immediate, and effective for basic up-close tasks. If you only occasionally need to read a restaurant menu or a medication bottle, they solve the problem instantly without a doctor's visit. But off-the-rack readers carry a physical toll. They do not account for the exact distance between your pupils, nor do they correct for small amounts of astigmatism. Wearing them for extended periods often results in severe eye strain. You can solve that optical strain by having an optometrist make you a pair of custom prescription readers. They are perfectly aligned to your face and provide incredibly crisp visual quality. However, both over-the-counter and custom readers share the same inherent flaw. They lock you into a single focal distance. The moment you look up from your book to a computer monitor or across the room, the world is a blur until you take the glasses off. This table shows how multi-distance lenses stack prescriptions. Lined bifocals carve out separated zones for near and far, forcing a harsh jump. Progressive lenses smooth that jump entirely by blending the powers, allowing a seamless transition to your reading material. That seamless blend requires a structural compromise. Because the varying powers are molded together, progressives create an unavoidable pocket of distortion, a subtle visual swimminess around the outer peripheral edges of the lens. They also demand precision. If you work a desk job, you may find yourself constantly tilting your chin up and down just to find the narrow intermediate zone that makes your computer screen readable. For people with massive monitor setups or intense cubicle jobs, eye doctors use occupational lenses. These lenses intentionally sacrifice distance vision to dramatically widen the intermediate zone. Your entire desk setup becomes perfectly clear without you needing to tilt your head. The trade-off is that these glasses must stay at your desk. You cannot wear them to drive home. There is no flawless multi-distance lens. You must trade either the smooth visual transition of a progressive or the uncompromised peripheral clarity of a lined bifocal in order to gain all-day functionality. If the physical inconvenience of swapping glasses is a deal-breaker, the next tier of intervention moves the correction directly onto the eye itself through contact lenses. In monovision, your dominant eye is corrected flawlessly for distance, the other for reading. This forces a balancing act, degrading depth perception. Alternatively, a multifocal contact lens projects both near and far powers into each eye simultaneously, unifying your depth of field. These require extensive trial and error for a doctor to fit properly. They carry a high recurring cost, and they rarely achieve the razor-sharp absolute optical clarity of a traditional pair of glasses. Discarding glasses requires your brain to work overtime filtering and merging complex visual data. You trade absolute optical crispness for physical freedom. When external hardware like contacts and glasses are no longer viable, the final step is permanent surgical intervention. While mostly reserved for patients already developing cataracts, surgeons can remove your natural stiffened lens entirely and replace it with an artificial multifocal implant, permanently restoring your range of vision. This route bypasses daily hassle. but requires taking on invasive medical risks, thousands of dollars in out-of-pocket costs, and an irreversible commitment to however your eyes adapt to the resulting focal outcome. On the opposite end of the medical spectrum is a completely non-invasive pharmaceutical approach, daily prescription eye drops. Currently moving through final regulatory approvals, these drops chemically alter the eye's mechanics, forcing the pupil and lens to adjust their depth of focus so you can see up close for an 8-hour workday without hardware. Eliminating lenses from your daily routine entirely means choosing between the permanent gravity of surgery or committing to a lifelong daily pharmaceutical habit. Before you sit in an exam chair and commit to one of these routes, there is precise data you need to gather. Audit your daily workspace. Take a tape measure and record the exact distance in inches from your chair to your monitors. Count how many screens you use, and note whether they sit at eye level or require you to look up. If your doctor lacks those exact measurements, they have to guess your focal length. If they guess wrong, your expensive new custom or occupational lenses will leave you squinting. Be prepared for the biological reality of adaptation. If you choose progressives or monovision contacts, your vision will not be perfect on day one. It takes 1 to 2 weeks for your neurological pathways to accept the new focal arrangement. You will likely experience mild dizziness and visual blur during that window. You have to push through it. If you want a cheap, quick fix, grab the over-the-counter readers. If your job relies heavily on computer screens, ask your doctor about occupational lenses. And if an active lifestyle prohibits glasses, begin the adaptation process with multifocal contacts. Taking control of presbyopia requires accepting that your eyes have changed. Success comes from measuring the exact demands of your daily life and choosing the optical compromise that supports it best.